everyone, welcome. We are going to discuss pediatric growth and development today. So we're going to begin with the smallest of our pediatric patients, talking about newborns. And newborns are typically titled newborns between 0 to 28 days old. So we're first going to talk about some of their normal vital signs and measurements because as you work in the clinic, you'll be assessing some of these things, and it's important to know what is normal and what is abnormal. So their respiratory rate, they often breathe very quickly. So if you think about adult patients, we usually breathe about 14 to 20 times per minute. And here they can breathe up to 50 to 63 times per minute. Their rhythm, it may not be a normal breathing pattern. It may be a little bit more irregular. And that's okay. They're still new. They're trying to work things out. And sometimes they have more shallow and abdominal breaths. So just know that that's pretty normal for newborns. Their heart rate, if you think about an adult, our normal heart rate is 60 to 100 beats per minute. For babies, it's much higher. It's going to be 100 to 205 beats per minute when they're awake and moving around. And when they sleep, it can go from 90 to 160, but still much higher than our normal adult heart rate. Then we look at blood pressure. So if you think about adults, again, our blood pressure, normal blood pressure for adults will be less than 120 or less than 80. Here, their systolic, their top number is usually going to be about 67 to 84 millimeters of mercury. So they have a much lower blood pressure than we do as an adult, but if you think about it, it makes sense because they have much less volume that they need their heart muscle to pump all the blood to. And then that diastolic, or that bottom number, would be between 35 and 53. Length, head circumference, and weight all depends on the gestational age. So if you think about, babies are supposed to cook for 40 weeks. However, we do have preterm babies, so perhaps the baby was born at 32 weeks, right? They're going to be much smaller, weigh a lot less, and be a lot shorter than a baby born at full term at 40 weeks. So it all depends on that. Also genetics. So a lot of times in those newborn days, you're kind of going off of what the baby weighed at birth, and you're going to track if they're gaining, because obviously that's where we want to go. Sometimes it is common for newborns to lose a little bit after they leave the hospital and go home, but eventually, usually within that 2-week span of being home, they should start beginning to gain again. Physical attributes of those newborns. Their movements are involuntary mostly. They don't have a lot of control yet. They can't see very well, but it's increasing day by day. Their sense of touch is most highly developed of the senses. That's why babies do know if they're being held or not, right? They have a sense of touch. And they also have what are called reflexes. They have a startle reflex, which is called Moro, a rooting, sucking, and swallowing reflex, right? That's what helps them eat, and that's how they know how to eat. Grasping, this is the cute little, if you put your finger in their hand, they're going to grab it, right? That's actually a reflex. It's not like, oh, that's my mommy, let me grasp their hand there, but it is actual reflex that when something touches the palm of their hand, they squeeze. And then fontanelles, these are the soft spots on the anterior, and they also have one in the posterior, and they are open in the newborn stage. So moving on to infants, 1 month to 1 year. This is the infant phase, 1 month to 1 year. If you're looking at vital signs, they're pretty similar to the newborn. The respiratory rate is slowing down a little bit. Our heart rate is slowing down a little bit as well. Blood pressure is increasing as we increase in size a bit. For length, they want to increase the length by 1 inch per month. That's a lot of growing, right? But during this phase is when we're having the most growth. If you think about a 1-month-old versus a 1-year-old, big change, right? Big change. So length, and then there's a 50% increase from birth length to 12 months. It's a ton, guys. They're really growing. Head circumference increases rapidly until about 6 months. It starts slowing down a little bit. And then their weight, you want it to double by 6 months. So let's say we have a baby my son was born at 7 pounds even. So let's say at 6 months, we wanted him to weigh 14 pounds, right? We want that birth weight to have doubled. Now, if the baby was born at 6 pounds, at 6 months, they would need to weigh 12 pounds, right? You're doubling whatever the birth weight is, and then triple that number by 12 months, so at 1 year. And so there's definitely a little bit of differences between infants here if you take that birth weight into consideration. So lots of things happening with those physical attributes, guys, if we think about these infants. They're increasing their control of their head. They're losing, if you think about an infant, they don't have control of their head, or a newborn, they don't have control of their head. They have what's called a head lag, so they're not able to hold their head up, a head lag. And by about 4 months, they should no longer have this head lag. They're developing gross and fine motor skills. They're starting to verbalize some babbles and then even short sentences by a year. And know that this is normal or average, and there are always exceptions. You'll hear all kinds of stories. My son didn't talk until he was 3 years old, didn't say a word, and now he's absolutely normal. Those are exceptions, guys, okay? This is the norm, and anything other than the norm needs to be documented so that we can, track that growth and development of the patient. Vocabularies in small words, mama, dada, by a year. Usually they're crawling somewhere between 6 and 10 months, walking between 9 and 16, and then the fontanelles, the posteriors, may close by about 12 months. All right, let's talk about toddlers. Toddlers are ages 1 to 3, and move this down a little bit. Respiratory rate, you're seeing it slowing again. Heart rate is slowing as well. Blood pressure increasing. Their height increases about 3 inches per year. So that height or that length has actually decreased from that infant stage to the toddler stage. Their growing slows down just a little bit. And they gain approximately 5 pounds per year. And these guys are learning how to be independent, right? They're getting potty trained. They're learning how to control their bowels and bladders. They're climbing stairs. They're verbalizing things more and more. By 2, 50% of what they say you can understand, intelligible. By 3, 75% of their words you can understand. And the average vocabulary of 200 words at 2 and up to 450 words by 3. They should be able to follow commands and respond to simple questions by 1, right? Follow, like, go get your shoes. They should be able to follow the commands or respond to a simple question, like, do you want water? Yes or no. With ability increasing as they age. Again, this does kind of fluctuate between individual patients or different toddlers, but this again is the average, the norm. Their eating habits change. They eat when they're hungry. They need fewer calories related to the slowing of their growth. And sometimes this is when they become picky eaters, and they'll have days where they don't eat very much, and then some days they'll eat a ton. And I know this from personal experience as well. Then we have our preschool age kids. These are our 4 to 5-year-olds. Here, their respiratory rate decreasing again, 20 to 28 breaths per minute. Heart rate decreasing, getting a little bit more like our adults. Blood pressure, you'll see that it is increasing still. Height increases 3 inches per year, still like those toddlers. And weight gain slows again. So we were gaining 5 pounds per year between ages 1 and 3. Now we're only gaining probably about 2 pounds per year. By this age, they should be completely potty trained. They should be able to run, skip, jump, ride a bike, jump rope, feed themselves, play with others, share interactions freely. Their vocabulary is up to 1,000 words by 4 years old. They begin reading, some sight words, different reading skills. They participate in some sports, maybe soccer or t-ball. They become curious about sexuality, and they learn by imitating adults. They're creative, and they also love to use their imagination. So thinking about these toddlers and these preschool age kids and their development, let's talk about play, because play is really important. This is how they discover their world. This is how they learn and interact with others. So let's talk about the different type of play that children use. So symbolic is when children make something stand for something else. So my son does this a lot. He will take a stick and say that it's a gun. So he is symbolically making something for something else. This could also be a patient or a child puts on a lab jacket or a little lab coat and they become the doctor, right? So it's symbolic. Onlooker play. Sometimes when children are more shy, they'll have this kind of play, but it involves watching others. So this is when the child observes others at play, but they don't participate. Or when the health professional or anyone kind of entertains the child and the child is just watching. Parallel play, and you'll see this a lot with younger children, kind of that toddler area, because they don't know how to interact or construct things together just yet. They'll often play beside each other, so side by side, but they're not interacting, and they're only interacting by virtue of being close to one another. But you'll see this very common in my daughters too, and if you were to peek into her classroom, you'll see the 2-year-olds often do this, that they'll be sitting beside each other, and maybe they're both playing with trucks, but they're not actually playing together. Associative play, this is a shared activity, but the communication, and it's very little, or it's not very organized. So they may be communicating and they may be doing the same activity, but it's not an organized play. So for instance, if there's a kitchen set, perhaps they're both playing with dishes and they're talking about the dishes, but they're not actually washing and drying them together or doing that activity together, if that makes sense. It's not very organized. Now, constructive play is organized. It involves the making or building of things, and our older children, starting a little bit preschool and then school age on, they are able to do constructive play. And then cooperative play are when rules are followed and goals are achieved. So if you think about playing different board games or coming up with, maybe they're playing Knights and Dragons, and there are rules that if you are a dragon and you've been, hit by a knight, you are out, right? So they're following rules and they're achieving goals. All right, so let's talk about those school age kids. This is going to be ages 6 to 12. Here their vital signs are becoming more like adults again. Height increases by about 2 inches per year, and weight is gaining about 5 pounds per year. Their motor skills improve. At the age between 6 and 8, they may become more interested in sports. They can ride 2-wheel bikes. A lot of times between these ages, they learn how to ride bikes without training wheels. During middle childhood, they may swim, roller skate, jump rope, climb fences. They're very active, right? Their immunity has improved because of their vaccines, but also being exposed to more germs through school. During the last years of school age period, as they get closer to that 12 age, they're going to start developing secondary sexual characteristics. So growing body hair or having breast buds develop. That is going to happen kind of at that end stage of school age. They have a really important meaning for peer relationships, and they become more independent from their parents and their families as they increase through this school age period. Their language skills are amazing. They're able to comprehend complex content, right? By 6, their vocabulary is 13,000 words, and by 12, they can understand 50,000 different words. So when you put it that way, I think it's really interesting just how much our minds and our bodies grow as we develop. And our last group of children here are our adolescent group. They are much more like adults, and you'll see here now it's going to be broken down into male and female growing because it does matter at that stage. We'd start developing different due to our genders. There are a wide variety of physiological changes here. They have much more physical strength and more endurance. They have better judgment, hand-eye coordination. They master a lot of skills that adults have. They can play more adult sports. Here, independence is very important to them from their parents and their family, and they're more focused on those career goals, right? So this is the last stage before adulthood where they're actually getting closer and closer to looking and feeling and developmentally being more like adults.